Hi, this is eCareAgora B2B Trade and Projects. This is the big picture of eCareAgora solution suite, which covers the entire healthcare ecosystem. There is the consumer health, B2B trade and projects, a discovery platform, various cloud-based services, and all these services depend on the provider repository, program repository, and secure citizen risk factors. Our focus in this presentation would be the B2B commerce, which contains both the physical transactions as well as online freelancing projects. Now, why a B2B, a business to business platform? The fact is that in healthcare, there are lots of players which include health research, public health, home care, laboratories, biotechnology, pharmaceuticals, data sciences and analytics, health insurance, medical care, medical imaging, medical devices, rural health. And there is need for trade, partnerships, and freelancing projects among all these providers in the healthcare ecosystem. And that is what we plan to provide in this eCareAgora B2B platform. And what happens on this platform? For each of the categories, we will be discussing the various trade opportunities and the need for freelancing projects. Starting with health research, we have all these goods which need to be traded between various providers in the ecosystem, and various freelancing projects where all the transactions can happen online. These include data collection, cleansing, proposal for grants, projects, documentation, need for multidisciplinary design teams, connect researchers with funds, researchers with translational research. And for home care, the trade includes devices, medicines, consumables, whereas freelancing projects include support, consulting, health and wellness, education, and telehealth support. Regarding public health, trade includes all this, and freelancing projects include mostly the emergency response activities and during epidemic breakouts, mobilizing resources. Laboratories, we have a trade which includes consumables, equipments, and projects which include the maintenance, consulting, and training. Biotechnology, we have the need for trade as well as for freelancing projects. Pharma, also we have the need for trading of medicines and raw materials, and freelancing projects include mostly research, clinical trials. In data sciences and analytics, there is the immediate need for online freelancing projects in all these areas. There are various areas where a niche or specialized skill set is required. So, such a platform facilitates locating this specialized skill set as well as availing those immediate needs. And just in time resources for various projects is a very popular need in this healthcare ecosystem, and our platform supports that immediate need. Coming to health insurance, we have the need for a trade and projects as these: healthcare delivery for hospitals, clinics. We have the need for trade, which includes all these, and freelancing projects include demand for all these. Coming to medical imaging, the need for trade includes all the ones mentioned here, and freelancing projects include teleradiology, online consulting, device and equipment maintenance, and imaging is a fast emerging technology where resources in demand need to be availed as early as possible, and this platform supports this immediate need. Medical devices, a fast emerging technology area where the need for trade includes medical devices, equipments, wearables and sensors, the various raw materials and consumables, and the infrastructure. And the freelancing projects include whatever is mentioned here. Clinical trials for medical devices is a fast growing industry. Here also the specialized skill set need to be identified to complete the work at the earliest possible timelines. Let us see how it works. This is how a service buyer works. A healthcare business or individual who is looking to get work done will post a service request, and based on the kind of job description and the registered providers in the system, the buyer gets recommendations on various providers. Based on the proposals submitted by various providers, buyer can shortlist the candidates and award the job. Finally, deliverables are obtained. Digital products and services can be delivered online, whereas for finished goods or raw materials, the buyer and provider collaborate. And finally, payment is done. Currently, Skrill and bank payments are supported, and we will soon support other modes of payment and escrow protection. Coming to a service provider, a healthcare business or individual who can provide services or take up projects. A provider will create a profile and portfolio highlighting his skills and previous experience. Based on the kind of jobs which are posted in the system, a provider will get recommendations. The provider can apply for the projects online, and the provider can work on the projects or deliver the physical products. Finally, the provider will get payment, and once the project is completed, based on the feedback and ratings from clients, the provider can set up his profile as well as boost his credibility.